Hip replacements have now got to the point where complications are really very low. So please bear that in mind as we talk through the risks of surgery. This video is not meant to scare you, it's meant to inform you. Think of it like this. If you go for a destination wedding in Florida in October, there's a risk you could get caught in a hurricane. It's definitely not for sure, and the chances are you'll end up with beautiful wedding photographs. But there are risks. And there are risks in everything you do when you stop to think about it. Hello, my name is Dr. Amit Atrey. I'm an orthopedic surgeon and I specialize in hip and knee replacements. The hip replacement risks I'm about to list are not things that will happen to you, but only things that could potentially happen. We will not review every single complication, but the more common ones and the more important ones. The first complication we're going to explore is infection. Your skin and my skin are covered in tiny bugs known as bacteria, but we rarely get ill from these bugs because skin is a super tight barrier. It stops all those bacteria that live on our skin from getting inside us and causing infections. During many kinds of operations, we make an incision or a cut in skin. Of course, that's now an opening in the skin barrier, and that can allow those bacteria, those bugs, to get in. Bacteria love to stick on to two things, metal and plastic. And as you now know, a hip replacement is made up of what material? Metal and plastic. So we as orthopedic surgeons are really obsessed with minimizing the risks of infection. We clean the skin before surgery, we clean our hands thoroughly, and we even wear 2 pairs of gloves. You'll also be given antibiotics before and sometimes after the operation. The operation will be done in a sterile operating room with all the equipment sterilized by heat, chemicals, and more often than not, radiation. And yet, infections still, although rarely, do happen. When bacteria get through the skin, often through a wound, they can cause an infection. Broadly, there are 2 kinds of infections, superficial or deep infection. Superficial infections are where the cut skin and the wound left behind get bugs growing within it. They're basically just skin infections. Superficial infections after a hip replacement are not uncommon. They're still less than 1 in 100, but they're not unheard of. Redness and swelling in the first few days of recovery is normal, as is some swelling and bruising around the wound site. But superficial infections often show themselves by increased redness around the wound. Or your skin may feel hot to the touch. You may see a pimple on the wound. We call that an abscess. There may be some discharge too. That looks like something leaking out of the wound. Now, most wounds leak a bit in the beginning. It's usually a little bit of blood or even clear, thin fluid for the first few days. That's normal. But when it keeps going or begins a few days after surgery and doesn't smell good and is hot and red, then it may be a superficial infection. These superficial infections usually respond well to simple tablet antibiotics. Antibiotics are medicines that kill bacteria. Let your surgeon or family physician know if you suspect a superficial infection. They can send you a script for those antibiotics. And of course, please remember to include any allergies you may have. Deep infection. If these bacteria manage to get deep down, especially around the hip implants, this is now a deep infection. This is an extremely rare condition, but can be a very serious situation. You may start to notice worsening pain with any movement. Putting weight through your leg may suddenly become more painful. You may have a temperature. You may have chills and generally feel terrible. Remember how I said bacteria like to stick onto metal and plastic? They grow really well there because they're protected. They can even develop a protective shield around themselves. If a deep infection occurs, it may require another operation to wash out the hip implants or even to replace some or all of the implants. It's important to stop the infection from evolving from a mild superficial infection to a serious deep one. So look out for the signs we talked about: worsening redness, pain, pus coming from the wound, which we call discharge, difficulty weight bearing, and also changes in the amount of pain around the hip joints. There are 5 big things that increase your risk of getting an infection: smoking, being overweight, being diabetic, being on steroids, and being older. If you smoke, your risk of infection is 3 times more than if you didn't smoke. We all know it's hard to quit smoking, but do your best. Even stopping for the 2 weeks either side of the operation will make a huge difference. Quitting completely will really help. It's the nicotine in the cigarettes that causes the problem, as well as the smoke. So even patches, vapes, and other options don't really make a difference. Being overweight or obese will increase your risk of deep infection by up to 3 times also. If you have time before your surgery, try and lose some weight. We know you can't exercise because of the pain in your joints, so you have to exercise control over what you eat, plus reduce portion sizes. Being diabetic also increases your risk of infection. The worse your sugar control, the more likely your chance of infection. Your physicians may have talked about your HbA1c levels. Your HbA1c is a measure of how good your long-term sugar and therefore diabetes control is. It's important to try and get this HbA1c below 6.5, or the worst case scenario, below 7. You could work with your family physician, diabetes doctor or nurse to get this under control. If you take steroids, maybe for diseases like rheumatoid arthritis, your risk of infection will again go up. You should speak to your physician who prescribes the steroids about the dosage and whether you can stop them. Your surgeon will want to know any medications you're taking. Do not stop taking steroids without medical advice. If you've had an injection of steroid into your hip, most surgeons will want to hold off surgery for at least 4, and for me, 6 months. Another risk after hip replacement is getting a blood clot. These are common when you're flying. If you've been on an aeroplane, you may have heard on the overhead announcement instructions telling you to move around the cabin and stretch your ankles. This is to prevent the blood clots from happening during a flight. These clots are called deep vein thrombosis, or DVT. Thrombosis is a fancy word for clot. When you have an operation on your legs, there can also be a high increase of DVT, or blood clots, forming. That means getting a clot in the deep veins of your calf. Your calf can become swollen, hard, or even possibly red. DVT can be very painful and slow your recovery. It's important you look out for it and contact your surgeon's office, your family physician, or the emergency department if you experience symptoms. If that clot gets bigger or a piece of the clot breaks off, it can travel through the rest of your vein system. The last place it ends up is the lungs. When the clot gets to the lungs act like a sieve and they trap it. If the clot is big enough, it can really affect your breathing. It can stop you from breathing. This is called a pulmonary embolus, or a PE. This clot in the lungs, or pulmonary embolus, can kill you. If you feel short of breath after your operation, you should contact your surgeon's office or go straight to the emergency department. This may be a medical emergency. These clots, whether in your calf or in your lungs, are serious. Fortunately, there are medicines we can give you to thin the blood and cut down the risk of clots. You'll be given a script for a blood thinner after the surgery. It's really important you take those. The next complication that can occur is dislocation. A dislocation is when the ball falls out of the socket. The risk of this is traditionally 1 or 2 out of every 100, but our techniques and our checks have gotten better over the last few years. Your normal hip is a big ball in a big socket. The socket is made even deeper by a thick rim of cartilage. The hip can move really long ways from side to side before it catches on the side and then will be forced out of the joint. When it hits the side of the cup, the whole head will fall out. This is a dislocation. When we replace the hip, the head size we use is about half or 3/4 the size of your real head. As you can see, the range of motion the hip replacement can achieve is less than the real hip. And this is why a replacement can dislocate. But the good news is that this is very rare these days. In most cases, if a dislocation happens, we have to put the ball back in the socket in the emergency department while you're sedated or sleepy. Or sometimes we have to do it in the operating room. If the dislocation occurs more than once or twice, you may need another surgery to have the implant position changed. In the first few weeks, there are certain positions that increase your chance of dislocation. And as certain surgical approaches are more likely to dislocate in different directions, your surgeon or physio may talk to you about these positions and how to avoid them. Other surgeons, like me, often don't have any restrictions after surgery, so it's important to clarify with your team. Naturally, you'll lose a little bit of blood during the operation. In recent years, we've given a medicine called TXA before the operation to lessen blood loss. But very occasionally, we need to give a top-up of blood. That's called a transfusion, and we make sure to check your blood type before the operation. There are many nerves that run down your leg. They are around the operation site and can be damaged during the procedure. You may have heard of sciatica. This is a shooting pain down the back and side of the leg. Sciatica is an irritation of the sciatic nerve, and the sciatic nerve runs down the back of the leg, not far from where we operate if we use the posterior approach. If the nerve is damaged, you could be left with numbness and potentially some weakness. This may be a foot drop. A foot drop is where your foot won't lift up. If your surgeon uses the anterior approach through the front, the lateral femoral cutaneous nerve of thigh is the most commonly damaged nerve. This nerve supplies feeling to the outer part of the thigh. You may be left with numbness and sometimes pain in this area. Most nerve injuries are usually temporary, but occasionally nerve injury can be permanent. And even if it's temporary, it can take several months to recover. We try really hard to make sure the leg lengths are perfectly equal at the end of surgery. If your sore leg is shorter to start with, the surgeon will lengthen you to be equal to the other side. Your spine also affects your length, so if you have a curvy spine, it may also make one leg feel longer than the other. Occasionally, your surgeon will lengthen you on purpose to make sure your hip is stable. You have to allow your surgeon a few millimeters of extra lengthening if they feel they want to get your hip stable. When surgeons have to get a tight fit when wedging the hip replacement into the bone, in doing so, especially if your bone is softer, you can get a break. This is a fracture or break of the bone. Due to all the reasons I've mentioned and some others like loosening of the implant, a hip replacement may need to be redone. This is what we call a revision or redo. Although these complications are serious, they are also uncommon. The list we just described are the more common complications that can happen, but there are others, and you'll have the chance to discuss them with the surgeon before you sign your consent form. Once again, these are complications that can happen, but are not necessarily going to happen. Now, let's get into the day of surgery. Joint recovery is your daily, at-home, physio-guided rehab program. You'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.